My name is Jessica. I'm a nursing student in NU 650. I'm here to do my video exam recording for cardiovascular, respiratory, abdominal, and peripheral vascular assessments. This is my patient, Melissa. Do you give consent to be recorded today?
Yes.
Okay, I give consent as well. I'm gonna hand wash as well as hand sanitize. I'm gonna have the patient lie down. We're going to begin with our abdominal assessment. I'm going to inspect her abdominal assessment. You can please lift that up. I'm going to look for contours symmetrical. Her abdomen appears symmetrical. There are no lesions. There are no drainage. There is no redness. I then am going to auscultate all bowel sounds. Bowel sounds are positive in all four quadrants. I then am going to assess her aorta. I'm going to auscultate it for any bruits, which I do not hear. I'm going to assess her renal arteries, which there are no bruits there as well. Then her iliac arteries, and then her femoral artery. Perfect. No bruits heard in any of those arteries. I'm then going to auscultate over her liver and her spleen for any vibration, any venous hums or friction rubs. Perfect. No venous hums or friction rubs noted. I then am going to palpate. I'm then going to percuss over all four quadrants. Perfect. Tympany is heard throughout. I'm then going to percuss over her liver, which appears dull, and her spleen as well. Perfect. I then am going to start palpation. I'm going to softly palpate. You let me know if there's any pain, okay?
Mm-hmm. No.
No. Perfect.
No.
And upon palpation, no masses, lumps, superficial masses are noted. I then am going to do a deeper palpation. Any
No.
pain?
No. No.
Any pain?
No.
Good. All right. I then am going to palpate her liver border, which appears there's no masses, no lumps noted. It should be about 6 to 12 centimeters in diameter. I feel it's about 7, which is good. I then am going to, I'm then going to locate McBurney's point. I'm going to push. Please let me know if there's any pain.
Mm-hmm.
Any pain?
No.
Perfect. All right, we are then going to assess for the Murphy sign. I'm going to have you take a deep breath.
Mm-hmm.
We are assessing over the liver. I'm going to push in, take a deep breath. Any pain?
No.
Good. All right. I then am going to have you lift up your leg and bend your knee. We're going to check psoas sign. If you can please bring your knee to your chest, and I'm going to push down. Please let me know if there's any pain.
No.
No pain in your abdomen. Good. Okay, after that, we are going to check obtrusor sign, which I'm going to extend and push to the right. Any pain?
No.
Perfect. And I'm also going to assess Rovsing sign, which is on the left side. Please let me know if you feel any pain in the right side. Any pain?
No.
Perfect. Okay. That completes. Oh, I'm going to actually have you sit up. And we're going to sit up and face that way. I'm going to assess her for CVA tenderness. I'm just going to bang on your back a little bit. Please let me know if there's any pain.
No.
No. Good. All right. That completes my abdominal assessment. We are going to move on to respiratory assessment. I'm going to inspect her chest wall. Are you a smoker?
No.
Have you ever had any respiratory illnesses?
No.
Okay. history of COPD or asthma?
No.
Good. All right, so respiratory rate and rhythm appear good. Rate appears even, unlabored. Her respirations appear to be about 16 beats per minute. She does not appear in distress. I then am going to palpate her chest wall for any lumps, masses, irregularities, which I do not feel. I then am going to palpate her back, her posterior chest wall, and assess for diaphragmatic excursion. Please take a deep breath. Perfect. Lung sounds or lung expansion appears equal and symmetrical. There, I'm then going to assess for tactile fremitus. If you can please say count to 5, okay? I'm just
Yeah.
going to feel your back.
1, 2, 3, 4, 5.
Perfect. Vibrations are equal throughout her back, or throughout her upper chest, which is exactly what we want. There's no vibrations that feel deeper on one side or the other. I then am going to auscultate her lung sounds anteriorly. Okay, take a deep breath for me. Perfect. One more. One more. One more. Good. Good. Lung sounds appear clear, with no adventitious lung sounds noted. I am going to assess for egophony. If you could please say E and hold it. I'm going to listen again, okay? E, 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 E. Good. Her E's are heard clearly throughout. There is no change in sound. I am then going to assess for bronchophony. If you could please say Scooby-Doo as I listen, that would be great. Thank you. Scooby-Doo, 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 Scooby-Doo. Perfect. And her Scooby-Doo appears to get more quieter as we move away from the larynx, which is exactly what we want. I'm then going to ask her to turn her legs in, but stay seated so that I can listen to her lung sounds posteriorly. All right, take some deep breaths. Good. Lung sounds are clear throughout. We are going to then assess for her whispered pectriloquy. If you can please whisper 99 while I listen, and I'll tell you when to stop, okay?
99, 99, 99, 99, 99, 99.
Perfect. And her 99 got a little bit quieter as we moved throughout, but that is good for her. Lung sounds again equal. No adventitious sounds such as rubs, rubs, crackles, rails, or stridor. That completes our respiratory assessment. I then am going to have her lay down and we are going to do our cardiac assessment. So I'm going to assess her neck. We are going to be focusing on her jugulars for any venous distension. I do not see any pulsations or any distension noted. I'm going to have her turn to the left side. Perfect. And to the right. Perfect. Again, no distension noted. Anything less than 4 is no jugular venous distension, which I would document for her. I will then inspect her chest wall. I don't see any pulsations noticeable. There are no changes in color or any wounds. I then am going to palpate for the PMI at the 5th intercostal. I'm going to have her roll to the left just to see if I can feel it a little bit better. And I don't really feel it too strongly, but on that note, we are going to auscultate her heart sounds. We're going to auscultate at the aortic, the pulmonic, Herb's point, tricuspid, and mitral. And then I'm going to then listen with the bell to listen for any murmurs or regurgitations. And we're hitting all those same points down at the tricuspid and the mitral. Perfect. Heart sounds are normal or regular. They are not tachycardic. I did not hear any murmurs, rubs, or gallops. From here, I am going to have you roll to the left side. We're going to assess for the mitral stenosis. We are in the left lateral decubitus position. And I do not hear any murmurs there. I'm then going to have you sit on the edge of the bed, and we're going to lean forward a little bit. And I'm going to have you take a deep breath and hold it while I listen for any aortic regurgitation. And hold. And no regurg heard. All right, so that completes our cardiac assessment. I am then going to move on to our peripheral vascular assessment. If you can please lay back down. Perfect. So peripheral vascular assessment, we're going to start by inspecting the skin. I do not see any change in color, no cyanosis, no clubbing of the fingers. Her skin appears pale, warm, and dry. Her lower extremities appear pale, warm, and dry as well. They appear symmetrical. There's no edema, no swelling, no varicosities noted. I then am going to assess for her pulses. We are going to assess her brachials, her radials, sorry. Good, they are strong, not bounding. I would give them about a 2, 3+. Ulnars are strong too. We are going to come up to the brachials, which are strong as well. And then I'm going to assess for her epitrochlear nodes, if I can find one, which her epitrochlear nodes are small, movable, they're not solid. I'm then going to move up to her axillary nodes. Her axillary nodes are movable as well. Any pain on? No. Okay. Perfect. So I'm going to move down. We're going to move to our superficial inguinal nodes. Any pain on palpation with these? No. Perfect. They appear movable, mobile, no tenderness, no nodularities. I'm then going to move on and assess her femoral arteries, which appear strong, not bounding. I'm going to have you bend your knees just a tiny bit. We're going to assess for your popliteal pulses. Those appear strong as well. And then we're going to move down to our posterior tibialis, which both appear strong, as well as the dorsal pedalis, which are also strong. I'm going to have her then sit up. And our final assessment here is going to be our Allen's test. So I'm going to pull her sleeve up and have her squeeze her hand real tight. And I'm going to occlude both the radial and the ulnar. We're going to hold this for about 30 seconds. And then I'm going to have her open her hand. We are going to note pallor. Open your hand. It's pale. And then I'm going to release the ulnar artery and we see flushing. So there is no occlusions noted. That completes my assessment for this exam. Thank you for participating and being my patient. I appreciate you guys for watching. Thank you so much.